Hi, welcome to our channel of IGNOU Audiobooks, Indira Gandhi National Open University School of Continuing Education, SOCE, Certificate in Early Childhood Special Education Enabling Inclusion Hearing Impairment, CESEIHI, BCD101 Introduction to Disability Block-1 Paradigm Shift in Disability Unit-2 Types of Disabilities Causes and Prevention 2.1 Introduction in Unit-1. You have read about the meaning of disability, the changing approaches towards disability. Disability is a condition that is present in all societies. The perspective towards and the definitions of various disabilities have been changing over time. After the enactment of the United Nations Conventions on the Rights of Persons with Disabilities, 2006, the definitions of disability have changed in line with social model of disability. In India, the Rights of Persons with Disabilities, RPWD, Act 2016 has defined various disabilities. In this unit, you will come to know about disabilities included in the RPWD Act 2016, their causes and measures for prevention. Objectives: after studying this unit, you will be able to use appropriate language for persons with disabilities, know the various types of disabilities as per Rights of Persons with Disabilities Act 2016, and explain the causes of disabilities and how they can be prevented. 2.2 Use of appropriate language for persons with disabilities. The use of appropriate language for persons with disabilities is very necessary in order to respect their rights as human beings. We need to remember that just as we would like to be addressed respectfully, so do the persons with disabilities. Disrespectful language and words for describing person with disabilities goes against the human rights of persons with disabilities and makes them feel humiliated, excluded, and becomes a barrier to their full participation. When we genuinely work towards an inclusive society, we will realize that language which dehumanizes has no place in our interactions with each other. You may have noticed that quite often people use the terms such as the following to refer to persons with disabilities: fool, imbecile, mad, idiot, deranged, crippled, retarded or dumb. This is insensitive, harsh and demeaning language which hurts their feelings. These terms create unfavorable images in our mind and arouse negative emotions towards them. These feelings then begin to dominate our interaction with the person with disabilities. It is not uncommon to come across people who, upon hearing that a person is blind, assume that he or she is stupid as well, or upon hearing that a person is crippled, conclude that he or she must be really ugly. Therefore, such terms must be avoided when referring to persons with disabilities. We also use these terms for people without disabilities when we want to insult them. For example, if a sighted person breaks some object or bumps into someone, we say, "Are you blind?" When these terms are used in this way for persons without disabilities, we are actually abusing the person with disability, and it makes it seem as if, because of their disability, they are lesser human beings. The condition of disability is used as an abuse. This is unethical. When referring to persons with disabilities, we need to use person-first language. And the words related to a disability should never be used as words of abuse. Let us understand what we mean by person-first language. It means an individual is a person first and the disability is secondary. So we first say person with and then add the disability of the person. For example, person with blindness/visual impairment, person with hearing impairment, person with intellectual impairment. Sometimes we use what we consider to be polite language to refer to persons with disabilities. So we say, special children or differently abled or specially abled. We think we are doing the right thing. But the persons with disabilities have objected to these terms because they feel that such euphemistic terminology hides their reality and the discrimination that they face. They feel that such terms give a false picture as if they have no problems at all or have different abilities from the rest of the non-disabled people. In fact, it is best to ask persons with disabilities which language would they like to be used for them, as there are some persons with disabilities who prefer to be called deaf or autistic instead of terms like differently able or special children because they feel the former terms a clear idea of their condition to others. The following table lists some examples of inappropriate language and also provides the alternate person-first correct usage. Inappropriate language: person-first language. Able-bodied does not have disability. non-disabled afflicted with, has dash differently abled persons with disabilities disabled-friendly environment barrier-free environment / accessible environment birth defect congenital disability / born with a disability / disability since birth low vision person with low vision / person having partial sight brain damaged person with brain injury cerebral palsy victim / cerebral palsied / spastic person with cerebral palsy wheelchair bound / confined to a wheelchair user / person who uses a wheelchair crippled persons with locomotor disability Down syndrome person / mongoloid person with Down syndrome handicap person with disability slow learner person with a learning disability mentally retarded / mental disability person with intellectual disability mentally ill / mental person having mental illness physically challenged person with locomotor disability polio victim person with post-polio syndrome psychotic / neurotic person with psychiatric disability / psychiatric illness vegetative state non-responsive differently abled person with disability 2.3 types of disabilities While the Indian Constitution protects the rights of all the citizens of India, yet to further strengthen the situation of the persons with disabilities and to meet their specific needs, the Rights of Persons with Disabilities Act, RPWD Act, was enacted by Parliament in December 2016. This act recognizes 21 conditions as disabilities. These 21 conditions have been broadly categorized under 5 broad areas: physical disability, intellectual disability, mental behavior, illness, disability caused due to neurological condition and blood disorders, multiple disabilities. Let us read about each of these broad areas if includes. A. Physical disability. This category includes conditions that affect a person's physical abilities, mobility and sense organs. Examples of physical disabilities may involve impairments in movement, coordination, limitations in the use of limbs and sensory impairments. Conditions such as orthopedic impairments, muscular dystrophy, locomotor disabilities, blindness, hard of hearing and speech disorders fall under this category. B. Intellectual disability. Intellectual disabilities are characterized by limitations in cognitive functioning and adaptive behaviors. Conditions like Down syndrome, intellectual developmental disorders, learning disability and other cognitive impairments are categorized under this area. Individuals with intellectual disabilities may face challenges in areas such as communication, learning, and socialization. C. Mental behavior. Mental illness. Mental and behavioral disabilities encompass a range of conditions affecting mental health and emotional well-being. This category includes conditions such as schizophrenia, bipolar disorder, and other psychiatric disorders. Individuals facing challenges related to mental health and behavior fall under this broad category. D. Disability caused due to neurological conditions and blood disorders. This area encompasses disabilities resulting from neurological conditions and blood disorders. Neurological conditions involve disorders of the nervous system, such as epilepsy, and multiple sclerosis. Blood disorders may include conditions like hemophilia. Individuals with disabilities arising from these medical conditions are recognized under this category. E. Multiple disabilities. Some individuals may experience limitations in more than one area, and their disabilities may be a combination of conditions from different categories. Multiple disabilities category acknowledges individuals who have impairments affecting more than one area, such as a combination of physical and intellectual disabilities or a combination of mental and neurological conditions. By categorizing disabilities into these 5 broad areas, the RPWD Act, 2016 aims to provide a comprehensive framework for understanding and addressing the diverse needs of persons with disabilities. Let us read the definitions of the 21 disabilities as given in Table 2.1 as per RPWD Act, 2016. Table 2.1, Types of Disabilities as per RPWD Act, 2016, Category S. No. Disability name: Locomotor Disability 1. Locomotor Disability 2. Leprosy cured person 3. Cerebral palsy 4. Dwarfism 5. Muscular dystrophy 6. Acid attack victims visual impairment 7. Blindness 8. Low vision hearing impairment 9. Deafness 10. Hard of hearing speech and language disability 11. Speech and language disability intellectual disability 12. Intellectual disability 13. Specific learning disability 14. Autism spectrum disorder. Mental illness 15. Mental illness chronic neurological condition 16. Multiple sclerosis 17. Parkinson's disease blood disorder 18. Hemophilia 19. Thalassemia 20. Sickle cell disease multiple disability 21. Multiple disability 1. Locomotor disability. Locomotor disability refers to problems related to bones, joints and muscles due to which a person is not able to carry out certain activities related to the movement of one's body or activities involving moving objects. 2. Leprosy cured. Leprosy cured means a person who has been cured of leprosy but is suffering from loss of sensation in hands or feet as well as loss of sensation and paresis in the eye and eyelid or extreme physical deformity due to which they are not able to undertake any gainful occupation. 3. Cerebral palsy. The word cerebral palsy is made up of two words, cerebral which means concerning the brain and palsy which means paralysis or inability to move. Basically, cerebral palsy occurs due to damage to the brain, which affects the ability to control muscles and so leads to difficulty in coordination of movement and positioning of the body. 4. Dwarfism. When a person due to genetic or medical reasons is short in stature i.e. 4 feet 10 inches, 140 centimeters, or less, it is called dwarfism. 5. Muscular dystrophy. This refers to a group of hereditary genetic muscle disease that weakens the muscles that move the human body. Persons with muscular dystrophy have incorrect and missing information in their genes, which prevents them from making the proteins needed for healthy muscles. It is characterized by progressive skeletal muscle weakness, and the death of muscle cells and tissue, weakness of muscles and skeleton affecting movements of body. 6. Acid attack. Acid attack means throwing acid or any other substance on the body of another person with the intention of taking revenge or disfigure them. Usually, acid or similar corrosive substance is thrown on the face or upper part of the body, leading to disfigurement. 7. Blindness. Blindness means a condition where a person is unable to see, after best correction, due to any of the following three conditions: total absence of sight, or visual acuity less than 360 or less than 10/200, Snellen, in the better eye with best possible correction, or limitation of the field of vision subtending an angle of less than 10 degrees. 8. Low vision, means a condition where a person is able to see only partially due to any of the following conditions, namely visual acuity not exceeding 6/12 or less than 20/60, Snellen, up to 360 or up to 10/200, Snellen, in the better eye with best possible corrections, or limitation of the field of vision subtending an angle of less than 40 degrees up to 10 degrees. 9. Deafness. Persons with deafness are those who are not able to hear at all, due to 70 dB or more hearing loss in both ears. 10. Hard of hearing. These are persons who have partial loss of ability to hear sound due to 40 to 70 dB hearing loss in both ears. In other words, their hearing loss ranges from mild to severe level. 11. Speech and language disability. This refers to inability to speak properly due to deformity of organs involved in speaking or any neurological condition. Persons having speech and language disabilities are not able to communicate effectively through the spoken mode. 12. Intellectual disability. Persons with intellectual disability have significant limitations in intellectual functioning as well as in adaptive behaviors. They have limited mental functioning, and have difficulty in understanding, following instructions, and recall of memory. They have limitations in communication skills and social skills. Because of this, they have problems in conceptual, social and practical skills. They need to be told things in simple and clear words, and this needs to be done repeatedly. 13. Specific learning disabilities. Lack of ability to learn and perform in a specific area, example mathematics, language comprehension, etc. The person has difficulty in comprehending language, speaking, reading, write, spelling or doing mathematical calculations. 14. Autism. Autism is a complex developmental disability that typically appears during the first 3 years of life and is the result of a neurological disorder that affects the normal functioning of the brain. Both children and adults with autism spectrum disorders typically show difficulties in verbal and nonverbal communication, social interactions, and in leisure or play activities. They find it difficult to relate to people and show repetitive behaviors. 15. Mental illness. This means a substantial disorder of thinking, mood, perception, orientation or memory that grossly impairs judgment, behavior, capacity to recognize reality or ability to meet the ordinary demands of life. However, this condition does not include retardation, which is a condition of arrested or incomplete development of mind of a person, specially characterized by subnormality of intelligence. 16. Multiple sclerosis. Multiple sclerosis refers to an immune-related disability in which an abnormal response of the body's immune system is directed against the central nervous system. It affects the ability of nerve cells in the brain and spinal cord to communicate with each other, because of which the affected person is not able to carry out various activities and experiences pain, fatigue, spasm, tremors and loss of bodily functions. 17. Parkinson disease. Parkinson disease or disability is a neurological disorder caused by degeneration of brain which hampers the ability to control body movements. The person may show symptoms like shaking/tremors/imprecise movements, muscle stiffness/rigidity, and trouble in walking and maintaining body balance. Gradually, the person has trouble in talking, sleeping, problems of memory, mental functioning and sometimes experiences behavioral changes along with the other symptoms. 18. Hemophilia. Hemophilia is a bleeding disorder caused by a deficiency of coagulation factor which prevents the blood from clotting. In this disorder, excessive bleeding occurs even with minimum injury, and sometimes it can become life-threatening as the bleeding does not stop. In other words, it is the impairment of the normal clotting ability of the blood. 19. Thalassemia. Thalassemia is an inherited blood disorder that causes the body to have less a quantity of hemoglobin than the normal. This disorder transmits through genes from parents to children. 20. Sickle cell disease. Sickle cell disease is a blood disorder caused due to destruction of the cell membrane of red blood cell. It causes chronic anemia, painful events, and various complications due to associated tissue and organ damage. 21. Multiple disability. Multiple disabilities means a person has more than one disability at the same time, in other words, combination of two or more disabilities. It may be cerebral palsy and hearing impairment, intellectual disability and blindness, or deafness and blindness. Benchmark disability. It may be noted that in order to be eligible for state benefits under the law, the person must be medically certified as having not less than 40% of a specified disability by the certifying authority. Such a person is medically certified as having benchmark disability. Check your progress. Exercise 1. Fill in the blanks for the following statements. 1. The Rights of Persons with Disabilities Act, RPWD Act, was enacted by Parliament in recognizing conditions as disabilities. 2. Locomotor disability refers to issues related to joints and muscles, impacting activities involving the movement of the body or moving objects. 3. Dwarfism is characterized by a person being short in stature, specifically inches or less, due to genetic or medical reasons. 4. Autism is a complex developmental disability resulting from a neurological disorder that typically appears during the years of life. 5. To be eligible for state benefits, a person must be medically certified as having not less than % of a specified disability. 2.4 Causes and prevention of disabilities. Understanding the causes of disabilities can help us to prevent them. Disabilities can occur at any of the following stages: during conception, pregnancy, at birth or after birth. At each of these stages there can be various causes. We have listed the causes and the preventive measures at each of these stages in tables 1.2, 1.3, 1.4 and 1.5. Table 2.2, Causes during conception and their prevention. 1. Age of the mother. If the mother is less than 20 years or more than 40 years of age, the chances of having a child with disabilities is high. Prevention. The mother's age between 20 to 35 years is the most appropriate period for bearing healthy children. Causes. 2. Previous history of disability in family, genetic/chromosomal abnormalities. This can occur when the parents have defective genes that are transmitted, or an abnormality occurs in the genes during cell division at the time of conception. Down syndrome, PKU. Galactosemia are caused due to these factors and lead to intellectual disability prevention. If there is a previous history of disability in the family, couples should go for genetic counseling, which may involve tests like amniocentesis. Marriages between close relatives should be avoided if there is a history of disability in the family. Causes 3. Rh incompatibility. If the Rh factor of the mother and fetus is not the same, then while the first child is not affected, the second child is affected if the condition is not treated. Prevention. Mother should find out if she is Rh way before conception. If mother is Rh way, then she should consult Table 2.3, Causes during pregnancy, prenatal, and their prevention. Causes. Prevention 1. Ill health due to metabolic disorders such as diabetes, high blood pressure, blood poisoning, toxemia, hypothyroidism, hormone disorders. Consult doctor regularly and stay under doctor's medication during the entire period of pregnancy. 2. Consumption of alcohol and smoking, using drugs by mother or in the environment. Mother should avoid smoking and use of alcohol. 3. Infectious diseases like German measles, rubella, HIV, syphilis, hepatitis, jaundice, meningitis, especially in the first 3 months of pregnancy. Get timely vaccinations before conception. Get 3 antenatal checkups done. Take tetanus injections to prevent infections. 4. Malnutrition of the mother, especially lack of vitamin A, can lead to blindness. Take balanced diet. 5. Self-medication without consulting. Take any medication only on prescription doctor. 6. Exposure to radiation, environmental pollutants, poisonous gases in the environment. Avoid such exposures. 7. Trauma, injury and accidents, bleeding. Minimize emotional stress and strive to maintain a content and equilibrium mental state. Table 2.4, Causes during birth and their prevention. Causes. Prevention 1. Prolonged labor. 2. Premature delivery. Take medical advice. 3. Birth complications, cord around neck, head injuries such as the use of forceps, assisted delivery, no birth delivery cry, lack of oxygen, strong medications, delivery by inexperienced and untrained people, negligence. Ensure delivery at health center under the supervision by of a trained medical professional. 4. Low weight at birth, less than 2.5 kilograms. Eat balanced and nutritious food during pregnancy. Table 2.5, Causes after birth and their prevention. Causes. Prevention 1. Ill health such as diarrhea and dehydration, severe jaundice, high fever with fits, measles, mumps, diphtheria, whooping cough, eye and ear infections. Immediate medical treatment from trained medical professional. If baby has high fever, cool infant's feet, hands, forehead with wet cloth and immediately take the child to the doctor. 2. Malnutrition, deficiency in protein and calories. Regular immunization at recommended ages. Observe hygiene to prevent infections. 3. Trauma, fall, head injury, physical punishment such as hitting on the head. Keep child's eyes and ear clean. Treat infections immediately. Do not bathe or swim in dirty water. 4. PKU, phenylketonuria. Immediate screening and detection and start treatment. Breastfeed the baby as long as possible. Supplementary feeding from 6 months. Give child foods rich in vitamin A such as milk products, fish, livers, eggs and other yellow foods. Seek immediate medical help. 5. Feeding the infant in lying position causes milk to enter the middle ear and can cause rupture of eardrum. Do not hit children. Do not leave infants unattended on the bed or near staircase or other places where they can fall. 6. Injury to eye or ear, tumor in the eye leading to visual impairment. Keep sharp objects like knives, drugs, acids out of reach. Do not allow children to throw stones at each other, especially at eyes. 7. Infections of the brain and spinal cord such as meningitis, encephalitis, cerebral malaria. Immediate medical treatment from trained medical professional. 8. Brain tumors indicated by fits, headache, increased head size, sudden change in sense of vision or smell. Immediate medical treatment for trained medical professional. 2. 5. Summary. Children with disabilities encompass a diverse range of characteristics, including physical, motor, cognitive, language, social, and emotional impairments. The experiences and challenges faced by these children in their environment, whether at home, in the community, or at school, may hinder their ability to function independently like their peers. Recognizing and addressing their unique needs, which go beyond the common requirements of physical care and love, is crucial for maximizing their learning and development. Using appropriate language for persons with disabilities is crucial to respect their human rights and avoid discrimination. Person-first language, which prioritizes the individual over their disability, should be employed, while derogatory terms and euphemistic language may be hurtful and perpetuate negative stereotypes. Consulting individuals with disabilities about their preferred language is essential for fostering inclusivity. The Rights of Persons with Disabilities Act, enacted in December 2016 in India, recognizes 21 conditions as disabilities, which are broadly categorized into 5 areas: physical disability, intellectual disability, mental behavior, disability caused due to neurological condition and blood disorders, and multiple disabilities. The 21 disabilities as per RPWD Act, 2016 are locomotor disability, leprosy cured, cerebral palsy, dwarfism, muscular dystrophy, acid attack, blindness, low vision, deafness, hard of hearing, speech and language disability, intellectual disability, specific learning disabilities, autism, mental illness, multiple sclerosis, Parkinson's disease, hemophilia, thalassemia, sickle cell disease, multiple disability. Recognizing the causes of disabilities is crucial for prevention, as these can manifest during conception, pregnancy, birth, or post-birth stages, each having distinct contributing factors. Thank you.